Part B of the OET reading test is pretty straightforward in a lot of ways. You read a short text and then answer a multiple choice question. For some candidates, though, it can be the most challenging part of the test because it really requires you to read carefully and sometimes manage some less common vocabulary. On test day, you'll see something like this. You can see in this question, it's a sentence completion task. You must choose the phrase that correctly expresses an idea from the text. Some questions will be a complete sentence in the form of a question, and then you choose a complete sentence or a phrase to answer that question. Hopefully that makes sense. Now, before we try and answer this question, be sure to subscribe to this channel for more E2 OET videos. So you can see the question here. One piece of advice I'd give is to read the first part, the incomplete sentence. Do not read the rest of the options. If you're trying to read the text and remember the answers at the same time, you're not going to be fully focused on the text, which you need to be. I know a lot of students will want to read all the options first, but trust me, avoid this approach. Okay, let's read the incomplete first part of the sentence. The guidelines for patient consent says practitioners should try to... Okay, so it's a positive statement. They should try to, not a negative, which would be should not. That's something to be mindful of. Next, just read the text. Focus on the reading. Focus on understanding what the guidelines are saying. What should they do? And what should they not do? You should be able to read it in 30 seconds, and at the absolute most, 60 seconds. See if you can read it in 30 seconds. I'll time you. Ready? Go. Okay, how did you go? Now, before we look at the answers, here's 3 quick tips. First, you want to not only find the right answer, but also practice eliminating the wrong answer. When practicing for the test, this is a great way to make sure you can answer some of the harder Part B questions. The second tip, watch out for instances where the language in the text contradicts what the answer options say. So, if the question asks if something is or can, often the text will say it isn't or can't. It's a simple positive-negative relationship between the language in the text and the question. These types of questions show up in a lot of OET tests. And my third tip, be careful with similar words in the answer options. Sometimes you'll see the same words, but it's not the right answer. Again, this is where it is wise to pay attention to positive and negative language, should or should not. So on test day, you'd have to take a look at the options and pick the one that is correct, and remove the ones that are wrong. Let's look at all the answer options and answer the question together. First of all, option A. Document discussions rather than obtain patient signatures. Well, if we look at the text, it says, but an informative and well-documented discussion with a patient may equally satisfy this requirement. So it contradicts the option, so it is wrong. Now remember, if you got it wrong, don't worry. Feel free to pause the video and reread the text. This is a normal part of preparing for the test. In fact, it's when the most improvement happens. Next, option B. Get the patient's consent in writing for legal reasons. Well, if we look at the text, we can see a clear negative phrase. There is no legal requirement for consent to be written. It is merely prudent. Again, this is where paying attention to the negative or positive aspect of the language can really help. Now, if the word prudent is new to you, you don't actually need it to answer the question. That said, if you're like me, when I'm preparing for a test and I come across an unfamiliar word, I usually learn it afterwards. It's not a bad idea when practicing for a language test to make note of any new or unfamiliar words after. And if the unknown word is in the answer option or question, definitely learn it. You won't want to see that word again on test day if you haven't done so. The words in the questions usually aren't too abstract or unusual, so it's good practice to learn any new words that are in the questions. They may come up again. So finally, we know that C is obviously going to be the answer now. So let's take a closer look. We can read here, care must be taken not to overestimate the scope of that consent. It is reasonable to infer patients' consent to their health records being collected and used during repeat consultations. However, this consent would not necessarily extend to the disclosure of that information to third parties, such as including health summaries within referral letters. That middle part is the key point. This would not necessarily extend to the disclosure of that information to third parties. That really has the key element. The rest of the paragraph just adds proper context. So remember, at the end of the day, this test is testing your reading ability. So the better your reading is, the easier it will be. And remember, you can practice your reading with one of our online OET courses at e2testprep.com. We have plenty of test-accurate practice questions in addition to mock tests and live classes. Sign up today. Let's do one more Part B question. Are you ready? So here it is. This question says, according to the medication safety notes, the potential risk for patient harm, A, has become greater over recent years, B, should be identified as early as possible, or C, is accurately monitored by incident systems. So let's read through the text to make sure we understand it. Medication safety. Medication incidents resulting in patient harm are the second highest reported category of incident after falls within healthcare incident monitoring systems. Up to 70% of medicines administered intravenously have one or more clinical errors, and medicine administration is the most common procedure cited in patient misidentification incidents. The potential for such occurrences should be recognized and barriers built into the system to prevent errors. Placing a protective strategy in the beginning stages of the medication management pathway can prevent adverse events occurring later in the pathway. For example, the risk of patients receiving a medicine to which they have a known allergy can be reduced by ensuring that information about known allergies are available throughout the episode of care. Okay, so by now you should have a pretty good idea of what that was about. Now we're going to turn our attention back to the answer options to eliminate incorrect ones and confirm the correct answer. Let's start with answer option A. So according to the medication safety notes, the potential risk for patient harm has become greater over recent years. Can you remember from reading that passage anything about the patient harm increasing over recent years or becoming greater? I can't. I don't remember reading anything like that, so I'm going to just leave that one for the time being, and I'm going to look at B. Answer option B. According to the medication safety notes, the potential risk for patient harm should be identified as early as possible. Okay, for this one, I'm going to need to go back into the text and confirm that it is in fact correct. I've got an intuition that it's correct. Now I want to confirm it. Okay, so look at this sentence here. The potential for such occurrences should be recognized and barriers built into the system to prevent errors. Look at B again. Should be identified as early as possible. Well, there's nothing there about being identified as early as possible. There is certainly something there about being identified. So let's read the next sentence. Placing a protective strategy in the beginning stages of the medication management pathway can... So that part there has something to do with being identified as early as possible. So far, I'm liking B. I'm not totally convinced, but so far it's the best. So now I'm going to check C and see if we can eliminate it. Answer option C. According to the medication safety notes, the potential risk for patient harm is accurately monitored by incident systems. Well, this is clearly wrong because it's saying in the text that the systems aren't actually working, and C says they're accurately monitored by incident systems. So far, I've eliminated A and I've eliminated C, and B is not too bad. And sometimes when you take this test, in reality, you're going to have to deal with that sort of ambiguity. And in fact, the answer is B. Once again, you can get access to more practice questions, including Part A and Part C reading tasks at e2testprep.com. Sign up for a course today. And that's it for Reading Part B in the OET reading test. Thanks for watching.